Good afternoon. I'm Carmen Clausen, sitting in for Rita Celli. Today, mandatory masks. What are the arguments you're having?
Wearing fabric masks or face coverings keep you from unknowingly spreading this COVID-19 virus and keeps the people around you from spreading it to you. It is about respecting and protecting each other.
Starting tomorrow, wearing a mask in indoor public spaces in Toronto is the law. Toronto joins the chorus of other municipalities across the province going the same route.
This will now be the standard whereby anyone going out in public should have a mask with them.
Kingston moved quickly after an outbreak at a nail salon. If you don't wear a mask at an indoor public venue, you could face a fine of $5,000.
Now, as a result of what has happened in our community, we've written an order to ensure that anyone entering them must now wear a mask.
Ottawa is announcing its indoor mandatory mask plan later today. London, Brampton, Mississauga are moving the same way.
I recognize it will be challenging, but we have implemented and imposed other bylaws which are equally difficult to enforce, such as walking your dog on a leash or, in fact, the smoking bylaw.
But just like the smoking bylaw, it's up to people on the front lines to enforce the rules. And that can lead to confrontations.
You're making me wear a mask, otherwise you're going to deny me service if I don't wear a mask. I'm at St. Joseph's Hospital. They're telling me that if I don't wear a mask, they're not going to assist me. They want me to leave.
That was a scene at a Toronto hospital. A Kingston coffee shop was the scene of another standoff when a customer refused to cover her face.
She then launches into a verbal barrage against my staff, starting with things like, your coffee shop sucks, you suck. And then that quickly goes on to take a racial angle to it. She goes on to say, why are you here? You should go back to your country. You guys are taking our jobs.
We want to hear from you. Are you on the front lines enforcing mask policies? Are you confronting the cashier? 1-888-817-8995. Are you arguing over whether masks should be mandatory? In about half an hour, we'll turn to gardening. Ed Lawrence on the radio and a team of gardening experts online. That's at 12:30. But first, mandatory masks and the arguments you're having. 1-888-817-8995. Our Twitter handle is at CBC Ontario Today. We very much want to hear your stories and your thoughts on mandatory masks and the arguments that you're having over this issue. Our guest today is Professor Laverne Jacobs. She's also an Associate Dean of Research and Graduate Studies at the Faculty of Law at the University of Windsor, and she is the Director of the Law, Disability and Social Change Project. Hello, Professor Jacobs.
Hello, good afternoon.
Thanks so much for joining us today. I want to just start by asking you about the confrontation that happened in the Kingston coffee shop with a customer berating the staff and resorting to racial slurs. What goes through your mind when you hear that story?
Well, it's a good question. I definitely think that racial aggression has no place at all anywhere. And so I think that racial aggression is never acceptable. I think that we need to find ways to ensure that everyone is protected, wearing masks if they can wear a mask, and that that incidents don't devolve into racial aggression and confrontations of that nature.
What can we do then to make this more of a collaborative exercise rather than a combative one? I'm not sure how it evolved into that anyway, but what do you have any advice on that for people who are working on the front lines and are confronting some of these people who have an issue with mask wearing?
Yeah, I think there are definitely things that we need to do. We need to determine ground rules in terms of how masking should be enforced. So it seemed to me that the situation with the Kingston coffee shop was one where the person who was attacked could have had some sort of support or reinforcement, whether that's reaching out to local police or to some other organization or agency that's set up by the government. I think that having a place to go is definitely important. I think that even before that, we need to think about and construct some ground rules for how, how masking will work. So, we need to say at the beginning that aggression, including racial aggression, is not tolerated, have a zero tolerance policy there. But we also need to think about other populations who may not be able to wear a mask. So, for example, people with disabilities who may have legitimate reasons not to be able to wear a mask. How will situations, affecting people with disabilities be determined? We need to think about vulnerable populations such as people of low income who can't afford masks. Will we have masks always available? So there are definitely significant concrete issues that need to be addressed. And I think they need to be addressed very early on in a consultative manner.
You are a person with a disability. Maybe you can say more about what the added complications of that are for people in your situation.
Absolutely. I can't speak for all people with disabilities, but I can say that what I have been hearing is about the difficulties with having to prove disability and the actual unfairness of having to prove and reprove yourself in terms of not being able to wear a mask. So there may be people with physical disabilities, people who have respiratory issues, mental health issues, etc., who legitimately are unable to wear a mask. Will they need to bring medical evidence? Will they be revealing a lot of private information to essentially strangers in stores in order to be served? I think that these are really important issues. Ontario has a law. It's the Accessibility for Ontarians with Disabilities Act. And within that law, one of the regulations enacted is a regulation dealing with customer service. And the customer service regulation refers to certain principles that should be respected when dealing with people with disabilities. For example, it's important that the independence and dignity of the person is respected. It's also important that the person is treated as equally as possible. So it raises questions. All of the situation raises questions about how we can appropriately serve people with disabilities in a way that treats them with equality, dignity, respects their independence. These are all issues that we need to think about.
The issue of people who maybe can't afford masks has also been raised. Do you think there's a risk of making a simple grocery store, a corner store, pharmacy off limits to people who might not be able to get one?
Absolutely. And I think that, people who have little financial means, who are unable to, obtain food from the grocery store, I think that's a very... that's just an unacceptable situation, I think, in Canada. So we need to think about how we can make masks available. Will there be funding so that local shopkeepers will have additional masks? Will there be other ways that people with lower income can obtain masks? I think these are important issues as well.
All right, we're going to take some calls. Tim is on the line from Alliston, Ontario. Hi, Tim.
Hello. I'm in Alliston now. I'm from Fergus. I work in the agriculture industry, so I'm on the road quite a bit.
Okay.
So,
have you been having arguments about masks?
Yes. We've had people yell at us because my wife can't wear a mask either. She has breathing difficulties as well. And refuse entry into store. We've had quite not a physical confrontation yet for myself, but people getting right into my wife's face and shoving her because she can't wear a mask and go to the store. And it's troubling.
So you both have respiratory issues, which makes it difficult for you to wear a mask.
Yes.
What do you say? Do people give you a chance to respond or to explain? Have you had that opportunity?
Some do. Some will just walk away and call you names. Now, I'm very open to why I can't breathe because I was in a barn fire a few years ago and I have non-allergic asthma. And it's rather troublesome for me because what I'm allergic to is air. And within a few minutes of putting a mask on, I'll turn a pleasant shade of gray followed by a blue. And it's rather troublesome for me. And then I see people who I know who have breathing issues, and you can see them struggling in a mask because they do not want to take the abuse and shame that is going to be dumped on them.
Professor Jacobs, I'm just wondering if you can offer some advice and what your thoughts are on what Tim is saying.
I think that this is a situation that illustrates why we need to have some sort of alternatives for people with disabilities, breathing issues, etc. And the alternative that I can think of is that in our design, we need to find a way for those who cannot wear masks for legitimate reasons to have other ways of shopping. So maybe that's online shopping. Maybe there is some other system that can be set up by the shops. But definitely, what comes to mind is that the shopkeepers need to be aware that, there may be people approaching who legitimately can't wear a mask and need to be brought into a discussion to determine the best way to serve these people. We need to have a whole of community approach in which everyone in the community is respected.
And how, I know that the municipal leaders have said they don't want to enforce, they want to use an approach that's education focused. I mean, I guess we're not there yet. If people like Tim are having these experiences, how can that be done efficiently and soon enough for fewer of these incidents to happen?
Yeah, well, I mean, certainly time is of the essence, but I think that we can take some time to meet virtually. Unfortunately, there have been many democratic spaces that have been somewhat limited in the municipal sphere. So now is the time to have meetings using the new virtual technology that we have started to become more adapted to through the pandemic in order to have these conversations. So I think those types of meetings can be done rather quickly, and I think that it would be possible to set out the various steps, ground rules, processes for people to engage with the shops, etc., and processes also for some sort of, ensuring of compliance and enforcement. I think that can be done.
Kristen is calling from Saugeen Shores. Hi, Kristen.
Hi.
Are you having arguments about mandatory masks?
So we aren't. I own a small independent pharmacy in the area, and we've implemented mandatory masks in our store, but we've made it so that we can adapt it for anybody's needs. We continue to offer free delivery in the area. We offer masks for purchase right at the door, and if someone chooses can't wear a mask or can't afford to purchase the mask, we can serve them right at the door. We offer a free clean needle exchange program in the area, so we have a number of people in the area who may not have the means to purchase a mask or can't wear them. So they open the door and kind of wave at us, and we, with our masks, will walk to the front door, ask them what they need, go back in the pharmacy, gather it up, and then bring it back out to them, whether it's a prescription, their over-the-counter purchases, or their clean needles or whatnot.
And so how do people in the area know that those services are available to them, and that you're thinking sort of outside the box in terms of who can wear a mask or who can't? Is there a sign
media.
Social media?
Social media has been a big one. Our front door has a sign on it saying we offer free delivery. I reached out to the health unit who helps us provide the free clean needles and let them know so that they can let their clients know as well that this is something that we offer. So we're trying to remove every barrier that we can to receive all of the services that we provide in the safest way possible during this time.
And Kristen, do you find that other business owners in your area are sort of on board doing the same things, or what? I don't know if you've been a part of discussions with other business owners, but if you have, what have you heard?
At the beginning of the reopening, masks were not nearly as common or promoted in our area, but we're seeing them more and more as people are coming to accept that this is going to be part of our reopening process. We're seeing a lot of face shields as well, and we offer those for purchase in the store as well, and I think that's another good option.
All right. Well, thanks for your call.
Thank you.
Professor Jacobs, any thoughts on what Christian had to say, and just in terms of the business perspective?
Yeah, I think that using social media is a wonderful tool. I'm really impressed by Kristen's store and the way that they are approaching this. I think that these positive approaches should definitely be shared more widely, and I'm sure that there can be a way for the municipalities to bring these different approaches together, to have a place on their website that can further share this type of information and approach, even as we are working towards perhaps more permanent or longstanding approaches through the municipalities themselves.
Allison is calling from Thunder Bay. Hi, Allison.
Hi, thank you for taking my call.
Are you having arguments about having to wear masks?
I would say they're more internal arguments, because I wouldn't go so far as to bring it up to a business owner. I was just out shopping today, and there are a number of businesses already jumping on board the mandatory mask thing. And it isn't mandatory in Thunder Bay yet. And my main argument is sort of twofold. One is that I don't think that people should be taking, or through purchasing or whatever, medical grade masks away from people who legitimately need them. Healthcare providers, doctors, nurses, rest home people, they truly need the good quality masks. And like I said, I was just out shopping, and 9 out of 10 people who are wearing masks, and there were a lot of them, they're not wearing them appropriately, and wildly wrong. Most people have them, they're on their face, but they're only covering their mouth, and it's pulled down underneath their nose. There's really no point to wearing a mask at that point.
So what do you think the solution is here then?
You know what? I really don't know what the solution is. I would like to see a little bit more common sense displayed by people, rather than just this panic. Everybody's wearing a mask, so I will too. There are certain populations, like older folks, who do need to wear them. Maybe there should be some sort of public service campaign, a TV commercial put by the government on how to appropriately wear a mask and how to take it on and off appropriately too, because people, they don't do that either. I mean, the cashier at Walmart was wearing one. She handled someone's groceries. She pulled down her mask to scratch her nose, and then pulled her mask back up. So that's all three things. That's a waste of gloves, that's a waste of mask, and then you're exposing everybody to everything, really. So why bother at all?
Thanks so much for your thoughts on this, Allison. Yeah, a lot of education out there. I think we could all benefit from how and where to touch and what not to touch. Marina, you're calling from Toronto.
Hi there. Yes, I live downtown Toronto in one of the tall high-rises, and I have an interesting challenge that no one talks about, which is masks inside the public areas or the common areas in the condominiums, elevators, lobby, etc. I vote with my feet when it comes to stores. Like I choose to shop in stores that have mandatory mask rules. I can, choose where I go or I don't go, but I don't have a choice when it comes to going home and leaving my house and using my elevator. And there's been a lot of pushback in my building, actually, to mandating masks. Very unclear as to why. One of the reasons I was given is, well, people don't know where to get masks, which is, 4 months in is ridiculous. Masks are readily available. People know how to get them. And frankly, there's about 1 million YouTube videos on how to make your own at home.
So just to clarify, Marina, in your condo building, they're saying nobody has to wear one in an elevator or in the common space?
It's suggested.
Okay.
Yeah, so there's been some nice signs put up about, we suggest that you do, but it's been a real uphill battle to get them to actually make it mandatory. And it's difficult to understand why, but I'm also kind of not hearing anyone talk about it. Everybody talks about stores and public spaces, but for people who live in condos, especially high-rise ones, or rental buildings, frankly, this is a real issue because there is no choice whether or not you go out. You essentially, if you're at risk, you can't leave your apartment, and that's not realistic. And it's only going to get worse as people start returning to work. The elevator traffic's going to get heavier. our hallways aren't really wide enough to allow for appropriate physical distancing, especially in our main floor elevator lobby where everybody, tends to congregate to wait for an elevator. So my building has reduced elevator capacity, but hasn't done anything about the fact that there's still the same number of people who need to use the elevator. And so it's been a real struggle, and I haven't seen anyone kind of discuss what to do around where you live.
A very interesting conundrum, Marina. I'd like to put some of those points to Professor Jacobs. And condo buildings, a lot of buildings have elevators, including low-income housing, I'm imagining. Professor Jacobs, what's your response?
No, definitely. I think this is a very important issue. As you mentioned, it's beyond condos. It's for people living in shared places generally. I think that the question of masks is really a human issue, and that if we can, bring forward the human elements, why we need to wear the masks, how they're protective of you and others. I think the more that we can get across the human reasons, people will see that and buy into it. But that's not to discard, of course, the ability to use other methods, as I've been saying. So things like campaigns or even regulatory bodies that are out there need to be, contacted and made aware of these problems so that they can address them as well. So maybe it's a matter of writing to government officials who are responsible for housing, condos, etc. as well.
We just have about 2 minutes left here. We're just going to try to squeeze one more caller in. Penny's calling from Oakville. Hi, Penny.
Oh, hi there.
What's happening with you and mandatory masks?
I work for a hospital in Southern Ontario, Halton Healthcare. It bridges 3 hospitals, Oakville, Milton, and Georgetown. And we noticed recently that when the directive from the head medical commissioner said that we were to start doing outpatient procedures, we started noticing people within the hospital not wearing masks. Patients were visiting to have diagnostic imaging, for example. There was a bit of an outcry, and so the IPAC group sent an internal memo to all staff saying, and I quote, "There is no high-quality scientific evidence to support the use of masks by asymptomatic patients and visitors." As far as I can tell, we're the only hospital in Ontario that has this non-universal masking policy. So if you're pre-symptomatic, you can walk right in. You don't have to wear a mask. And it's a big concern because we all know now that the emerging evidence is saying that pre-symptomatic and asymptomatic carriers can in fact spread, and it can be the beginning of small outbreaks. And it's this particular doctor who heads IPAC at Halton Healthcare also is the quote-unquote specialist who Halton region depends on for infectious disease evidence, and that's one of the reasons I believe Halton region is not instituting this masking policy as well.
Penny, I want to thank you so much for your call, and as has been demonstrated this hour, a lot of education would be useful out there as far as masks go, and for me too. Professor Laverne Jacobs, thank you so much for your thoughts on this today.
Thank you, Carmen. Thanks for having me on the show.
Professor Laverne Jacobs is Associate Dean of Research and Graduate Studies at the Faculty of Law and the University of Windsor. And we're coming up to a break for news in about 30 seconds. And stay tuned after that. Ed Lawrence is going to be here to take your gardening questions.